You're watching The World Now on TVC News. The United States has officially withdrawn from the World Health Organization. U.S. President Donald Trump signed an executive order signaling the withdrawal a year ago, having criticized the organization for being too China-centric during the COVID pandemic. The U.S. Department of Health and Human Services says it took the decision due to the World Health Organization's alleged mishandling of the pandemic, its inability to reform, and political influence from member states. The WHO has rejected these claims, and its Director General, Tedros Adhanom Ghebreyesus, says the withdrawal is a loss for the US and the world. Washington has traditionally been one of the biggest donors to the WHO, but has not paid its fees for 2024 and 2025, which has already caused huge job losses at the organization. Joining me now from Abuja to discuss this controversial development is the Vice President, Medical Initiative for Africa, Dr. Agbo Ebuta. Thank you so much for joining us at this time.
Thank you for having me. Always a pleasure.
All right. So the U.S. exit leaves the WHO without one of its biggest donors. In plain terms, how dangerous is this decision for Africa?
This decision is unprecedented, and it will come with significant impact. This decision takes off the table 15% of the WHO yearly budget. That comes to about 600 to 700 million US dollars. Most of this funding at the end of the day is channeled to countries with weak healthcare systems, especially in sub-Saharan Africa, where more than 50% of the countries have their yearly budget less than 5%, far below the 15% recommended by the Abuja Declaration. So this is going to have significant impact on all the kind of support programs that these countries enjoy. WHO intervenes on multiple levels. It intervenes technically, supporting government policies, driving government policies. WHO also records and takes data, ensuring that the standard disease surveillance, analyzing this data and publishing it in a very transparent manner that allows countries to react appropriately where necessary. Where you have cross-national and subnational health conditions like Ebola with potentials for pandemic potentials, countries within Africa that have weak healthcare systems are unable to react. So that's where WHO comes in with data, with technical support, and when necessary with troops on the ground to ensure that these healthcare systems are supported. And we can mirror what has happened after USAID withdrew funding, because last year the USAID withdrew funding, and it was estimated that as a direct result of that, over 750 deaths have now occurred due to loss in funding for particular programs like HIV and malaria and a few others.
All right, so programs are already losing staff because funding hasn't come in. Are African lives now at greater risk because of this withdrawal?
I would say yes. WHO has lost about 20% of their staffs. Now, apart from withdrawal in funding, the US also withdrew their personnel that were either embedded in WHO or were assigned to support WHO. This withdrawal of technical support also reduces the efficiency and the speed with which policy interventions and the kind of work WHO is doing, and it reduces the efficiency of WHO in delivering some of these deliverables and increases the turnaround time for some interventions. So it's significant. We have interventions like in Nigeria, for example. WHO has supported several programs. The National Health Fellowship programs, WHO is somewhere in the background. A few other innovative programs, the policies, the new policies, the Nigerian healthcare renewal intervention programs that are in place. The WHO has significantly supported technically and otherwise. So it's going to significantly impact health systems. We may need to draw up a supplementary budget for health, especially if we need to close up the gap.
All right, so final question from me now. The U.S. says WHO failed during COVID-19. From where you sit, did the WHO fail Africa, or did global politics fail the WHO?
Well, to a large extent, there are several nuances. A lot of people do not share the opinion of Donald J. Trump, who is the major proponent that WHO was too China-centric and WHO covered up for China in terms of COVID. But some of these claims are still unsubstantiated. So I prefer to go with what we have data to support right now.
Okay. If another outbreak is to happen tomorrow, which continent will be more vulnerable because the U.S. walked away?
I think we would all be vulnerable. The US would not be within the space of the WHO because the US has now said that they are going to do G2G interactions. They are going to work with individual countries, NGOs, and faith-based organizations. That would increase completely the number of partners they need to work with, unlike a streamlined intervention through WHO. So everybody is going to lose out. Africa, with the weakest health system, will be worst hit, very likely.
All right, so which critical health areas in Africa will you feel this first vaccines, disease surveillance, emergency response, or frontline workers?
Sorry?
What critical health areas in Africa will feel this first?
Well, first and foremost, WHO supports a lot on leadership and governance, which is one of the 6 components. So we are going to, there will be some weakness in leadership and governance. The second aspect would also be in vaccine logistics, vaccine standards, disease surveillance will also be weakened because we in Africa do not have all of the capacities to maintain and cross-national, international disease surveillance outlook. We depend a lot to WHO because of the fabric and the network. Let's not forget, WHO has been in existence for the last 78 years, and they've done a lot of work. They have a strong institutional history, strong traditions, and to a large extent, they are our best opportunity at global health intervention. So weakening it significantly is a loss for all partners.
All right, Vice President, Medical Initiative for Africa, Dr. Agbo Ebuta, thank you so much for talking to us.
You're welcome. Always a pleasure.